Hey guys, welcome back. Today we're going to be talking about something which is near and dear to my heart because I've always participated in a various number of sports. And if you've ever done sports, whether it's part-time or a weekend warrior or any other way, you have been exposed to soreness. The interesting part is the American College of Sports Medicine has qualified that as something called DOMS, which is delayed onset muscle soreness. And it's an interesting phenomenon in that it occurs approximately 24 to 48 hours after exercising, not exactly after you do the exercise within an hour or two. And then it can persist for up to 3 to 5 days, but usually gets better. So there's your take home. Now the question is, what is it? What causes it? How can you make it better and how can you prevent it? That's what we're going to be talking about today, so join me. Hey guys, Dr. Nene here. I practice as a cardiothoracic, vascular, and general surgeon, and I'm now a health tech innovator who wants to improve lifespans and lifestyles. So stay healthy, stay curious, and keep watching. DOMS was classified as something which occurs in a delayed onset muscle soreness up to 24 to 48 hours after you work out. And the interesting part is it can persist for 3 to 5 days, but in general will subside after that. It's seen to cause muscle soreness, tightness, and overall you feeling like the Tin Man without oil. And it can be on muscles which you're using in a particular sport, like your calves or your quadriceps or your arms or your back, or it can be other muscles which you never have worked out before, but all of a sudden get used. So if you're playing tennis, for instance, a lot of times you're making some very sporadic movements and you never ever use a muscle or train it, and you might do it. What's the difference between DOMS and an injury? It's interesting because in DOMS, what you're getting is microfiber ruptures. And this is one of the patterns in which you build muscles, but it's also one of the patterns in which you damage it. And it's those microfiber ruptures which lead to a degree of inflammation, some redness sometimes, and some pain associated with that. Now the question is there anything you can do to prevent it? And so I'm going to go through the different steps you can take. Number one, diagnose it. So now you know if it happens 2 days after you work out, it's probably DOMS. Now the question is, can you treat it? And the answer is they've done a lot of studies with that. What they found is when they looked at massage, sports massage in particular, which if you talk to professional athletes, you talk to trainers, you talk to all these guys, they do recommend some type of sports massage. When they did a study looking at time of massage at 24 hours, 48 hours, and 72 hours, they found that the folks who took the massage at 48 hours actually had a decreased time span of DOMS. And so massage is helpful. Now the exact mechanism by which it improves it is a question mark. Does it mobilize fluids from the muscle tissue? Does it kind of soothe and stretch some of the areas? We don't know. But the point is, it does help with DOMS. The second thing is stretching, both to prevent as well as to treat. It's interesting because it's thought DOMS is caused by hyperextension, but also extenuated periods of extending a muscle beyond its normal reach. And that leads to the microfiber tears. Now, if you're punching weight and you're trying to build bulk in your muscles or do something like that, that's what you want. But if you're just working out, walking, climbing a hill, running, playing soccer, doing something active, a lot of times you'll do it without even thinking about it, where you're in an extended motion and your muscle is stretched and has small tears. Does stretching help? Well, certain types of stretching do help. And what's been shown is that dynamic stretching or while you're warming up actually is very helpful. And what I mean by that is that you're stretching in the same axis as what you'll be playing in or you're moving in. Now, oppose that to something called static stretching, where you just hold the muscle stretched for a period of time, and at least early on when your muscles are cold should not be used. But after you actually work out or you play or you do something, static stretching may actually reduce the extent of DOMS or even prevent it. Another finding was that if you hydrate very, very extensively, you're apt to not have as bad muscle soreness. And what they mean by that is prehydration, perihydration, and post-hydration. That means making sure your hydration state before you start working out is good. During workout, that you're constantly teasing some water in. And then after workout, making sure you hydrate. Do you need to add anything to that? Well, some people have proposed adding different types of herbs and spices, what I call elixirs, creatine, this, that, and the other, might help. The studies are inconclusive, and so I would be hard-pressed to tell you to do one thing or another. The next thing is, what other things can you do with topical analgesics? They do have icy hot, they have very cold, they have capsaicin, which is the red chili powders, which actually block pain. All of those can give you symptomatic relief, but none of them have really been shown to reduce the duration of DOMS. What has actually been shown to potentially reduce it is cold water immersions. And if you'll see in huge training rooms where football players and other people work out, they often are dunked for 5-10 minutes in these ice baths. And that has been associated with some decrease in muscle soreness. Whether that decreases the inflammation that you get from the small muscle tears, or whether it helps you to kind of reduce the inflammatory cascade is the question. No one really knows, but it has been shown to improve things. Next is oral analgesics, and things like ibuprofen, non-steroidal anti-inflammatories, or even Tylenol can give you symptomatic relief. But none of them have been shown to reduce the duration substantively. They do make you feel better though. And so if you're having bad muscle soreness, you could take a dose so that you can get around and do your daily activities. Next is staying active. This is a very important one. There were some studies originally which suggested that lactic acid buildup with anaerobic respiration, meaning that when you basically have worked out so hard, all of the glycogen stores or the sugars are gone and the oxygen is gone and your muscles are working in an anaerobic environment generating lactic acid. The lactic acid buildup was thought to make muscle soreness occur because you don't have enough perfusion or blood flow in that area to take it away. That theory has kind of gone by the wayside and it's not really prevalent. It is true though that if you work out the same muscle consistently and you are doing the same exercise, your periods of soreness will actually go down. And the thought behind that is that you're not tearing as many fibers as you build up muscle and you can take the strain of what you're doing. If you think about it with a weightlifter, for instance, if you start out with 5 kilos and you're consistently doing 5 kilos, eventually your muscle will get big enough to handle the 5 kilos. It's when you push it to 10 kilos, 15 kilos, 20 kilos, when you want to bulk up, that you're going to end up getting muscle soreness as your fibers tear to meet the demand. And that's when you also will get bulking. And so the idea is simple, that as these muscle fibers tear, you get the muscle soreness in a delayed fashion, and then these different measures which we've talked about will improve things. Finally, the takeaway is DOMS is generally not life-threatening, and it will get better. Are there some conditions under which you should definitely go in? Yes. If you end up starting to see your urine color change to very dark colors, indicating that you may have some muscle breakdown and something called rhabdomyolysis, or alternatively, if you are having back pain or other things, having significant problems with urination, you definitely need to go in. Secondly, if this persists greater than 7 days, you should definitely go see a doctor, because this is not delayed onset muscle soreness. Instead, you've probably injured yourself. And in which case, the real question is, you just, in most cases, have to rest it for longer. But if there is a substantive injury which needs treatment in the way of splinting or a cast or other measures, the best thing to do is to go see a doctor so that they can take care of this. Finally, be aware of all of this when you start to work out. The worst thing you can do is this weekend warrior phenomenon where all your friends are going out, hitting balls, doing things fun, all that. The idea is to slowly kind of rev up and do a little bit every day until you get comfortable with it, and then start playing on the weekends. Don't just go 0 to 100 miles an hour and expect to not get injuries. It is easy to say when you're 15 or 20 because you're playing all the time, and this isn't really an issue. It gets harder when you get to my age, you're above your 30s, 40s, and 50s, that you start to get into trouble. And the last thing I want you to do is to suffer. So anyway, I hope you found this helpful. It covers most of the issues, and we will leave kind of the nuggets and the references in the description. But I would love it if you left your comments on how you treat DOMS. That's a new acronym which you've learned today, delayed onset muscle strain or delayed onset muscle spasm or pain. And then always remember to like, subscribe, and share, because you can help other people kind of get over things, and we can become a community together. Thanks for joining me, and I look forward to seeing you in the next episode.